Good afternoon, colleagues. We are a very warm welcome to our virtual open day for the Faculty of Health Sciences. And we really are looking forward to hosting you today at our virtual open day event. And so to start with, we'd like to just share a quick a video that gives you a little bit of insight into what's happening at the Faculty of Health Sciences and the kinds of programs that we run. Thank you so much.
I chose UCT because I wanted to go to the top university in Africa, and I wanted to be assured that my education would be top quality.
So what is special about UCT? I think it's the name.
UCT is so world-renowned for its research.
UCT offers world-class education, which is led by researchers in the field of medicine and other health science courses.
And getting exposure to the doctors and surgeons that teach us in the hospital, I can honestly say that we are exposed to world-class leaders in their field.
The research in the department is so incredible. Like, we work with amazing professors and amazing doctors and academics.
Coming from a small town in the province, I received a warm welcome from the lecturers, from the tutors and the mentors at the university.
The most appealing thing to me about studying at UCT was definitely the culture. It really appealed to me because it seemed as though it was a community. So I really wanted to be a part of that community.
We integrate across all disciplines, not only medicine, but occupational therapy, physiotherapy, audiology, speech and language pathology. We're all doing similar courses in the becoming a health professional courses, and it really feeds into what the faculty is trying to put out there, right? Which is an integrated health professional who's non-judgmental, empathic, and knows how to collaborate with other disciplines in a multidisciplinary approach.
What stands out about audiology at the UCT is just the amount of access we have to the different facilities available. Like, we're close to the ski hospital, and there's just easy access to different clinical sites. There's different hospitals that we can go to, and there's always equipment available so that we can have that hands-on experience or real-life experience with patients and with the equipment that is needed in the clinical setting.
I enjoy the most on the clinical platforms is just interacting with different people, with children. I love children, and it brought me out of my comfort zone. Like, I'm very shy naturally. I'm a very introverted person, so that brought me out of my shell. I'm more confident now, and it's all thanks to like going to extra clinics, volunteering, speaking to patients. The more practice you get, the more confident you become.
So one of the reasons I'm interested in rural health is that I come from a rural province myself, where healthcare delivery is sometimes not the very best. And part of the reason I came to UCT was to gain the skills that I would use and take back to help improve healthcare in provinces like my own.
I also just really was fascinated by the idea of student wellness. I didn't really know that there was a whole division of the institution which caters to the wellness of the students, and I found that so fascinating, especially because I went through so many different things, and those lecturers and those support structures, the student wellness, they really were there for me. And it has been quite fascinating to realize that a lot of the time you think that you're alone on this journey, but there's so many resources that are here for you to help you and to just see you through your degree. So that has just been one of the things I've really appreciated about being at UCT.
In first year, they offered us mentorship. Each first year has a mentor. And for me, that was very helpful in terms of emotionally and academically. When I was struggling with anything, I had my mentor on WhatsApp.
I went into RES, which I think was definitely one of the best decisions I ever made. So it's been an incredible opportunity to meet people from across South Africa and make really good friendships with people.
RES is more of family, but it's a home in itself because it has its own culture.
It's like being basically in a sleepover with all the people that you study with.
The vibe is really one of belonging. One feels part of a family.
Yeah, I definitely do feel like I belong at UCT.
There's a lot of societies to join, and they're fun and educational, which is what you want, just a good balance between fun and educational.
You have sports clubs like UCT Soccer,
Choco Education,
The Surgical Society,
UCT Gym,
UCT Tennis,
I signed up for UCT Athletics,
boxing,
swimming.
Cardiology Society.
also Latin ballroom dancing. I've heard a lot of people recommend that one.
So whatever it is that you're interested in, UCT has it for you.
I would have tell my younger self, like, just go for it, because ultimately it depends on what you're going to do with this opportunity that lies ahead of you, and I think UCT is one of the best places to develop yourself.
You'll be doing what you love with different people, and you grow in ways that you wouldn't otherwise.
If I knew then what I knew, now I'm working here and I'm permanent, and I'm probably going to be a prof in 30 years' time, and I'm here to stay.
So it's really to make the most of the opportunities that you have on campus, because one day you will find yourself as an intern, as a community service medical officer, where you may be on your own in a health facility and you have a lot of responsibility on your shoulders. And it's then when we realize how much we were given in our university lives.
You're just expanding your potential as a person. It's not only just about being a student and studying the particular program, but you are able to go beyond that and become the person that you want to be in the future.
From my academic life, where, as I've said, I've had a world-class education with leaders in the fields of medicine, to being on the sports field at UCT, to being able to just enjoy Cape Town for what it is, climbing mountains on the weekends, going to the beach. I really do recommend coming to UCT, and if you aren't going to accept your offer, you will regret it.
I can't imagine myself anywhere else, really.
All right, so thank you so much, and I hope that that gave you a little bit more of an idea as to what's happening at our faculty. I'm going to start a little presentation with you now, and just to be able to share with you what you can expect when you come to the Faculty of Health Sciences. So we really hope that you choose UCT Health. This is our faculty. We're situated right adjacent to Groote Schuur Hospital, so just a short walk across from the upper campus of UCT. We'd like to be able to interact with you during the session, so we really hope that you have your smartphone or device ready with your browser open, and we'd ask you to type in menti.com and then wait for me to give you a code in a few minutes. So just type in menti.com onto your smartphone or device with your browser open, and we'll get that to you in a second or two. So why choose UCT Health? Well, we have this incredible legacy of the first heart transplant, and this was the Times cover at the time with the first transplanted heart by Dr. Christian Barnard, with the most incredible team behind the scenes of our Professor Hamilton Naki, who was one of the instrumental people behind the scenes in teaching all of the surgeons how to in fact do that incredible surgery. We have incredible breakthroughs, including some work around CT scans, for instance, the first developer of the CT scan, around coronavirus vaccinations. So the Sisonke trial was commissioned here at UCT. We've done some incredible work around myocarditis and cardiomyopathies, particularly amongst the Black population in South Africa, where very little research had been done before. We have some incredible role models. So Professor McLeod Cormack was the developer of the CT scan. Yeah, did you know that the CT scan was developed in South Africa and at our very own UCT, at our very own Faculty of Health Sciences? Professor Dumo Bakwa was instrumental in some incredible work in primary healthcare. Professor Francis Ames was one of those instrumental in exposing what had happened around the death of Steve Biko and his torture, and our very own Professor Bongani Mayosi, who did some of the incredible work around the genetics and cardiomyopathy in the Black population of South Africa. Our innovators, we have During COVID, we had some incredible work with Dr. Muzammad Ismail around developing the coronavirus dashboard for the Western Cape Department of Health, and Professor Sudesh Sivarasu, who really does quite phenomenal work around biomedical engineering. So all of these are just some of the amazing work that happens at our faculty. Our leadership includes myself in the middle of that picture, together with our other deputy deans and our dean. Our dean today is unfortunately attending to a family bereavement, and so is unable to be here. And so I'm leading the session together with Saeed Miller, who will be joining you shortly and taking over from me, who leads our Health Sciences Students' Council. And they're really quite an amazing bunch of students who, A, keep us on our toes, but B, really drive some of the incredible work that happens at the faculty. So what are we here for? At the faculty, our aim is to produce a generalist health professional capable of providing healthcare in a decentralized health system, imbued with a spirit of inquiry, and above all, committed to the principles of equality and social justice embodied in the primary healthcare approach. So who are those generalist health professionals? Well, our programs include the Bachelor of Science in Speech Language Pathology, the Bachelor of Science in Audiology, the Bachelor of Science in Occupational Therapy, the Bachelor of Science in Physiotherapy, and the Bachelor of Medicine and Bachelor of Surgery. We also offer 2 non-degree undergraduate programs, the Higher Certificate in Disability Practice and the Advanced Diploma in Cosmetic Formulation Science. So we'd like you now to enter into your menti.com the code 81744494 and start to look at what profession you are interested in. So let's hear from you. Which profession are you particularly interested in? And you can have more than one, because maybe at this point in your growth, you're not quite sure yet what profession you're interested in. So let's hear from you. There'll be a second question about rating how much you know about each of the programs offered here. So I'm going to move over to that particular screen at the moment and be able to ask you which particular program you're interested in. So let's hear from you. What programs are you interested in? And so we're going to see which ones are your particular interests, and we're going to just find out from you shortly. So what is it that you are interested in? I see lots of people already interested in the in medicine. I'm just struggling to present for some reason. I see all of you coming up now. So let's just see whether we can get you all going. I see that there's lots of you, but for some reason this is deciding. So I'm just going to stop for a moment. There we go. There we go. All right. So some of you are unsure. A number of you are looking at medicine. A number of you are looking at physiotherapy and occupational therapy. And it's wonderful to see a number of you looking at audiology and speech language pathology. That's really exciting. So at the moment, we are looking at about 150 of you so far online. So it's climbing still a bit more. And I hope that those of you who are unsure today will be able to get a little bit more certainty about what it is that you might be interested in. So really delighted that those of you who are here are being able to interact with us. So let's go. I'm going to give you just a few more chances just to see what you might be interested in. Alrighty, so still lots interested, and this represents more or less the proportions, by the way, of the class sizes. So our biggest class size, about half of our program size in undergraduate health professions program is in medicine, and the other half are made up by physio, occupational therapy or OT, speech language pathology, and audio. All right, so let's move on to the second question. So the second question is, rate how much you know about each of these programs. So even if you're interested in in medicine or others? How much do you know about the other programs, so that you can make sure that in fact the program that you're choosing is the one that you really want to know? So let's see how much you think you know. All right, so some people are saying they've researched and they know a lot, and some are saying that they don't know very much yet. So come on, let's see all of you participating in this one. We can see that there are about 25 of you have answered now. And so it's really important that that you come back to the individual sessions today. I see that that people who are that there are many who don't know quite as much about audiology and speech language pathology. So make sure that you come back to those sessions towards the end of the day to make sure that that you get to know what those are all about, because that's really exciting to be able to understand a little bit more. So even if you are choosing those programs, it's really important that you come back and understand a little bit more about what each of these mean, what they do, what the opportunities are about. And so certainly what it's seeming like is that all of you have lots to learn. And so that's really exciting for us to be able to share that with you today. So you're welcome to carry on doing that, and we can share the results with you. Just to remember that all of these are going to be these presentations today. So even if you miss one or two, all of these presentations will be recorded, and you will be able to share, to be able to listen to them a little bit later. So I'm delighted that we can still share some more with you today, that you'll be able to understand a little bit more about what's going on. So let's see now what we can tell you a little bit more about some of these programs. All right. So in these programs, the audiology, speech language pathology, occupational therapy, and the physiotherapy are all 4-year professional qualifications. So everybody who is in one of these professional qualifications has to register with the Health Professions Council of South Africa during the course of your student years. So you're actually already registered as students, as health professional students, and have a code of conduct to adhere to because of that. And for the top 4 programs, that is a 4-year professional qualification followed by 1 year of community service in the Department of Health around the country. And MBCHB is a 6-year professional qualification followed by a 2-year internship and a 1-year community service. And all of these require registration with the HPCSA. So the next part of this is to understand that our courses we also learn together, which is really important, that many of our students understand what each other does. And so we have this amazing course in first year called Becoming a Professional, followed by a second part of it called Becoming a Health Professional. And you can see that our students are reporting that these help us to understand what the things are that concern a health professional in the working environment. And ultimately, this is what you're focusing towards, is to graduation at the end. But what we need to help you understand is that when you are a health professional student, unlike other degrees in other faculties, is that you become a professional. And so it's more than knowledge and more than skills. There's a whole range of what we call attributes or graduate attributes that you exit with. And so you're not only exiting with head knowledge and with procedural skills, but you're also exiting being a professional, knowing how to engage as a professional in that environment, that you know how to communicate both with your colleagues, with seniors, with juniors, but also very importantly with your patients and with their communities. It's important that you are aware of how to collaborate, because we can't help patients and help communities with their healthcare without doing it together. And so collaborating and teamwork is really important. We also need to understand that we are leaders and managers in very many aspects of work. And so those are parts of the attributes that you will be learning during your courses. You also will learn how to be an advocate, because it's not only important for us as health professionals to be treating disease, but very importantly that health is not just an absence of disease, but also a state of complete social, psychological and mental, spiritual, as well as physical well-being. And so it's really important that we understand how to be an advocate. And then the scholarly work is both about knowledge, but also about research. And so we all need to understand what it is that gives us new knowledge, that helps us to understand things and get better at what we do. So where do we teach? Well, we teach not just at our Faculty of Health Sciences physical buildings, just at the foot of Devil's Peak, but we also teach throughout the peninsula. So there are a range of training sites in all of our main suburban areas. And there are hospitals called tertiary hospitals where all the specialized care happens, secondary hospitals where some of our generalist specialists occur, and then some of our primary care facilities. So those would be community health centers, they would be clinics, etc. And so those are all some of the spaces that we learn, including schools and NGOs. So we don't only practice healthcare in health facilities, but we also practice in some rural spaces. And so our students get the wonderful opportunity to travel to Vredenburg, to travel to George and Knysna and Mossel Bay and Oudtshoorn, where we have some incredible learnings from communities who operate differently to that in a metro environment. So another reason to come to UCT is that we have some incredible innovative teaching and learning. So the one thing about health professions learning is that you learn at the bedside of a patient, and that's certainly from a few years up. We learn in laboratories, in dissection halls, and we also learn online. And so here are some of our amazing teachers, both in the clinical space as well as online, which we had to do. I'm sure that all of you have had to experience some online teaching, and we've had to certainly keep it interesting over the past 2 years. We also have some amazing simulation laboratories where you learn on mannequins first before you move on to live patients, how to intubate, how to conduct life support. And so all of that happens in our spaces. We also have some amazing state-of-the-art facilities which you start to get involved with. And some of these are our specialized radiotherapeutic devices and stereotactic radiosurgery. So some really incredible resources that we have available. But one of the things that we always remind ourselves on, even through the COVID pandemic, is the human touch or the human connection, that is just so incredibly important. And that's why we do what we do, and this has been so difficult with masks and gloves and visors to be able to still keep the human touch going. So that's just something to bear in mind. And hopefully you've had a little bit more insight now. So if you come to UCT, there are just so many opportunities, and these include opportunities to progress beyond your own degree. But even if you're in your degree, there are also opportunities to branch out and do things like an intercalated Bachelor of Science, which means that the intercalated means that you can do, for instance, an MBCHB and a BSc at the same time, or a master's degree and an MBCHB at the same time. Yeah, very few of those because it really is very hard work, but it is quite phenomenal. Opportunities for you to do research. So every single of our undergraduate degree programs gives you an opportunity to undertake some research. And once you are qualified, of course, researching, teaching, specializing, practicing are all parts of the wonderful opportunities that we offer. So I'm going to hand over now to our chair of our Health Sciences Council, and he's going to take us through some other opportunities. So thank you so much, Saeed Miller, for joining us this morning and for being able to share with those who've joined us.
Thank you, and good morning to all prospective students and parents. So the Health Science Student Council is a group of 10 democratically elected students every year, and our key role is to help students fulfill the academic goal, which is graduating by advocating for the most ideal teaching and learning environment. Other opportunities in the faculty include, as you can see, societies and developmental agencies. And societies such as the Surgical Society allow students to explore the fields of surgery and academic surgery and academic research. Also, a developmental organization such as SHOCO is student-run. It's a non-profit community outreach organization, and they typically run clinics in underprivileged communities. Next slide, please. And this is just to show that while you are here for an academic journey, you can also lead a social life, attending the events held on campus by the faculty and by societies, and also socialize, mix with people, meet new friends. Next slide, please. So this is our Student Development and Support Service staff, led by Mamnonkosi Malala and Sibulele Mkuchulwa. And the Student Development and Support is the first stop for students facing any non-academic challenges. So they provide psychosocial support to students having personal, adjustment, or identity issues, as well as provide health, bereavement, and emergency financial support to those in need. Next slide, please. And then mentorship. So all first years are assigned to mentors, and mentors are typically senior students in the program that first years are studying. About 5 to 7 mentees are assigned to a mentor, and they guide them on how to adapt to university life, give them tips on how to deal with academic stress, with assessments. Yeah, and also the mentors, they report back to a mentor committee, which designs an effective mentorship program that best suits the needs of all students. Res Life. So first year students qualifying for UCT residence will be placed in a catering residence. Each residence has their own history and traditions, but they all contribute to having a great university experience. The health sciences residences are situated close to campus in Observatory, and these are Clarinus Village, Rochester House, and medical residence. They provide a common room for meetings and social interactions, self-operating laundries, and some have sports and entertainment facilities. The UCT shuttle transports students from these residences to the upper, middle, lower, heating, and health sciences campus. What our teachers say. So yes, a testimonial from Gillian Ferguson, who is an associate professor in the Division of Physiotherapy. And she says that she's part of this diverse and dedicated expert team of physiotherapy lecturers, clinicians, and researchers. This division takes great pride in developing close relationships with students, and they constantly strive to create a supportive and inclusive culture where everyone is valued. The undergraduate program is well known for producing socially responsive graduates who can think critically, and the postgrad programs in physiotherapy, exercise, and sport have graduated colleagues who are respected locally and internationally for their research and clinical expertise. She's a proud alumnus of UCT Physiotherapy and recommends that you take up your place in physiotherapy. Next slide, please. And then another testimonial from Ntiki Mapukata, who's a senior lecturer in the School of Public Health and Family Medicine. And she's saying that they will support you as you transition from being a learner in high school to becoming a university student in Africa's leading institution. You will engage in a range of collaborative learning strategies where you embrace modern technologies. Vula, the official learning platform, is your playground. And you're in a group of 10 to 12 students with a facilitator during first year to gain skills to become a professional. And then in the second semester, you will gain skills to become a health professional. Next slide, please. And what our students say, and a key thing to note, is that the lecturers embody all the qualities that any healthcare worker should have, and these are empathy, kindness, and dedication. So the Faculty of Health Science provides you with the opportunity to further your studies and develop skills relevant to the fields of audiology, medicine and surgery, occupational therapy, physiotherapy, and speech-language pathology, while allowing you to serve communities through developmental agencies, societies, as well as enhance your leadership skills and social connections. I'll hand back now to Kerrin to talk about becoming a healthcare superhero.
Thank you so much. So colleagues, for the rest of this afternoon, we have some more presentations to get to know some of those programs in a little bit more detail. So physiotherapy starts at 1:40 p.m, occupational therapy at 2:10, communication science disorders at 2:25, and MBCHB or medicine also at 2:25. So we really look forward to seeing you in some of those sessions and looking forward to telling you more about how to become a healthcare superhero. So thank you so much for joining us, and we hope that that you've been able to see some of those questions and answers as we've been going, and we look forward to sharing some more with you as we go along. So thank you so much, colleagues. I think that we may have got to the end of our time slot, and so we've hopefully been able to answer your questions, but please do contact us on the admissions email address should you have any further queries and questions, and we look forward to meeting you during other sessions. Keep an eye out, and we hope to have some interaction with some of our prospective applicants during the course of the rest of the year. Thank you so much.